Hi Allison, this is just a quick tutorial on how we got Terry out of a regular chair. This is not the lift chair, it's just a regular recliner that she would use sometimes so that she could move to another room. It's covered with a full or queen size fitted sheet just to keep it clean. It can be replaced if it got food or anything on it.
Feels a little like a bed too.
Yeah, made it feel a little more like a bed for her. Behind her is a flat sheet that is just sort of folded in fours and draped across the back of the chair. And she sat like this a lot with the pillow in front of her. I think it made her feel secure that area was protected. What Gregory or your helper will need to do is just take the sheet and bring it all the way around her like this, all the way, and we'll have to physically pull you forward because you probably will have a very hard time leaning at all with your own strength. So I would, or your helper will pull, and then you will be able to use your feet, your legs, to stand up. Now, let me just tell you, it will not go that smoothly because you will be sore and tender and a little nervous and protective a little bit of your body. So it will not go that smoothly, but that's the basic motion, to just wrap this tight around you and pull slowly until you can get your feet under you to stand up. That's why the lift chair is great, because it will bring you up almost to standing with just the push of a button, wasn't it? Or
right, with the little remote control.
So that certainly made it a lot easier. The recliner is nice, but the jarring motion, I don't know if you even remember this, but the jarring motion was very difficult because it would, that sudden movement was somewhat painful. So it's great to have, but it was not really the ideal situation. The lift chair is
a second choice.
Yeah.
Not the lift chair is perfect because you don't realize that the muscles you use, even to make this small movement, you're using your chest muscles. So even this small thing you can't do. So anything that helps you not have to lift yourself up, you can't lean forward, someone to help pull you forward, or the lift chair lifting you forward, and even the back comes up and helps you stand up because you're weak.
And so often Terry would get up in the middle of the night and need to go to the bathroom, or just to take meds or something like that, and it was much easier for her to just be able to lift herself up than for Gregory or your caretaker to be able to have to go through the process of trying to pull you up and unmake the bed, because that was basically her bed for several weeks. So
these are the awesome pillows.
These are the tacky pillows I was telling you about. But when I tell you, it was like a child with a teddy bear. Yeah. She had to have them with her at all times.
And you do like this, and I don't know what makes them perfect, because as you can see by the looks of them, it's something that you would resist holding on to.
It's almost heart-shaped. Almost sort of heart-shaped, the look of it.
It fits. Your arms are uncomfortable down by your side, and it adds just enough to where your arms are just out enough. I mean, by the end of the first week, I would have them behind my head, and just all sorts of little things. You get tired of sitting in the chair, so you kind of want to act like you're sleeping on your side, so you put them over to the side. I mean, they're just really... they end up being a help to everybody. So don't throw them out when they bring them to you in the hospital, because you will learn to love this right here with these little pillows.
But that's their use. That's what they're supposed to be used for, is under the arm. But they did sort of become a security blanket, and then she would also use it to prop up in different ways. So definitely
a
little tacky, but they do the job. And the airline pillows that we talked about, sometimes are stuffed a little too tight, so you end up where your arms go up too high and it's not comfortable. So that's why the tacky hospital pillows are really the best option.
I thought this would be a great idea. It's not. That's all I have to say. It's not.
Yeah.
So these little more flexible, cushy, small pillows. But this is definitely, they're designed this way to fit just for mastectomy patients, and they're really fantastic.
Is there anything else you can think of?
There was a couple things on the counter. Maybe we can start a new video.
Okay. That's it for the chair. We have a few more tips, but that'll be in a subsequent video. Bye.